Hello, everyone. Today, I'd like to sit down with you to talk about something deeply important for men: prostate cancer. This is a disease I've seen so many face, some in its silent early days, others when it becomes a real challenge. But here's the good news. If we catch it early, the story can change entirely. Did you know that according to the latest data I follow from the American Cancer Society, prostate cancer is the second most common cancer in men, just behind skin cancer? This year, 2025, the numbers still weigh on my mind. Hundreds of thousands of men might receive this diagnosis, and tens of thousands could lose their lives if we don't act in time. But I'm not here to scare you. I'm here to share knowledge, experience, and hope. Let's dive into the 10 early warning signs of this disease, signals from your body that you should never ignore. All right, let's get to the heart of it. The 10 early signs I've gathered from my clinical experience and trusted medical research. I'll walk you through each one, sharing real stories so you can picture it clearly. If you notice any of these, don't panic, but don't wait either. See your doctor right away. Sign 1. Painful or burning. Urination. The first sign is pain or a burning sensation when you urinate. I remember a patient, Nam, 55 years old, who came to me and said, "Doc, it feels like fire every time I go." When the prostate enlarges due to cancer, it presses on the urethra, disrupting the normal flow of urine. That can cause discomfort or even infections, a cycle I've seen far too often. If you feel this, don't brush it off as a minor thing. Let a doctor check it out. It might be your body's first whisper of trouble. Sign 2, frequent nighttime urination. Next up is frequent urination at night, or nocturia. Ever wake up 3 or 4 times at night to use the bathroom? I had a patient, Uncle Hua, who complained he couldn't sleep properly because he was up so often. This doesn't just tire you out. It could mean your prostate is acting up. Try keeping a log of how many times you go each night for a week. That's something I often suggest to patients to gauge how serious it is. Sign 3, blood in the urine. The third sign is blood in your urine, known as hematuria. I once met Tuan, who was terrified when he saw his urine turn pinkish. There are 2 types: microscopic, only visible under a microscope, and macroscopic, which you can see with your own eyes. In prostate cancer, this often shows up in later stages, but I always tell my patients, don't wait for it to get that far. A simple urine test can catch it early. Sign 4, pain in the back, hips, or legs. Sign number 4 is pain in your lower back, hips, or legs. I cared for a patient, Dung, who had nagging back pain with no obvious cause. After an X-ray, we found the cancer had spread to his bones. This is a serious sign, often seen in advanced cases, but if you're dealing with unexplained pain, get it checked now. Don't let it quietly steal your health. Sign 5, sudden weight loss. Finally, for this part, sudden weight loss without explanation. An old patient of mine, Uncle Long, dropped 5 kilograms in 2 months without changing his diet or exercising. Cancer, including prostate cancer, can make your body starve for energy, leading to fatigue and weight loss. If you're shedding pounds and don't know why, it's time to see a doctor and dig deeper. Sign 6, rectal pain. The 6th sign is pain in the rectal area. I recall a patient, Hung, who came to my clinic worried, saying, "Doc, it hurts every time I go to the bathroom, and sometimes I'm constipated." When prostate cancer spreads to the rectum, it can cause discomfort like this. from a dull ache to something more noticeable. Don't assume it's just a digestive issue. A thorough exam, like a digital rectal check or ultrasound, can reveal the real cause. Sign 7. Pain when sitting. Next is pain when sitting, a sign many overlook. I once met Uncle Ty, a truck driver, who told me, "Sitting too long feels like it's piercing my bones, Doc." When the prostate enlarges from cancer, it puts pressure on the pelvic area, especially on hard seats. If you feel pain in your pelvis or lower back while sitting, don't delay. Your body might be signaling something bigger. Sign 8. Difficulty urinating. The 8th sign is trouble urinating. Standing there, trying hard, but the stream won't come or it trickles out. A patient, Min, once shared, "I feel like my bladder's full, but I can't do anything about it." This happens when the prostate squeezes the urethra, blocking the flow. I always tell my patients, if this is you, see a urologist pronto. Don't let it drag on. Sign 9. Loss of bladder control. Sign 9 is loss of bladder control or urinary incontinence. I cared for son, who was embarrassed to admit he'd leak urine without warning. This can happen when cancer damages nerves around the prostate, or after treatments like surgery or radiation. Don't feel ashamed. It's a medical issue, and we have solutions. Sign 10. Painful ejaculation. Lastly, sign 10. Pain during ejaculation. I remember a younger patient, Keen, who said, "Doc, I'm scared to be close to my wife because it hurts every time." The pain can range from a dull throb in the lower abdomen to a sharp sting in the penis or rectum. This isn't trivial. It's your prostate crying for help. If this persists, step it up and talk to a doctor. Now you might wonder, why does the prostate turn cancerous? After over 30 years of study and practice, I can tell you we don't have the exact answer yet, but here's what we know. It starts when cells in the prostate grow abnormally, ignoring the body's natural life and death cycle. They clump into a tumor, and if unchecked, they can spread, a process called metastasis. I've seen cases caught early, with tiny tumors we could handle easily, and others that came too late, spreading to bones or lungs. The key is knowing your risk factors to stay ahead. Age, risk climbs sharply after 50. Family history. If your dad or brother had it, your odds are 2 to 3 times higher. Obesity. Extra weight can make the disease tougher and more likely to return. Ethnicity. Men of African descent, as I've seen in practice, face a higher rate. I tell my patients, knowing your risks is the first step to controlling them. So what can we do to lower the risk? From my experience, here are simple, effective steps. 1. Eat healthy. Load up on greens, fruits, and whole grains. I often advise cutting back on red meat and saturated fats. 2. Exercise. Just 30 minutes of brisk walking, 3-4 times a week, boosts your health. 3. Manage weight. If you're overweight, shed it gradually. Your body needs time to adjust. 4. Regular checkups. Men over 50 should test their PSA, prostate-specific antigen, routinely. I've caught so many cases early this way. 5. Talk to your doctor. If you're high risk, ask about drugs like finasteride, but weigh the side effects carefully. I firmly believe prevention beats treatment. A healthy lifestyle doesn't just shield your prostate, it helps you live better overall. My dear friends, prostate cancer isn't a death sentence if we catch it early. In my 30-plus years as a doctor, I've seen countless men beat it and thrive. If you spot any of these signs I've shared, don't hesitate. Call your doctor today. Thank you for spending this time with me. If you found this helpful, please like, subscribe, and share it with loved ones. I'd love to hear your stories. Leave a comment below, and I'll try to reply to each one. See you in the next video.